New at 6 tonight, nurses have played a huge role in the COVID-19 patient treatment and recovery. The COVID-19 pandemic has forced healthcare workers to face some unprecedented scenarios, increasing the risk of post-traumatic stress symptoms. Febin Casahoon explains how our local nurses have been impacted and what's being done about it.
Nurses in the Tri-Cities have dealt with a different kind of work within the last 12 months. I spoke with a top ballot health official on how nurses have operated during this pandemic.
From working additional hours because of the volume of COVID-19 patients to wearing 12 hours of PPE and distancing themselves from family. Nurses have had the entire world in their hands, and the ones in the Tri-Cities were no different.
Even our nurses who were not necessarily assigned to COVID patients had to have levels of PPE above what they normally do because of the fact that COVID can be asymptomatic.
Ballot Health's Chief Nursing Officer Lisa Smithgall says that they've had an increased turnover of staff in their hospitals due to the pandemic.
A lot of nurses who were approaching retirement age with the increased stress, opted to retire in the summer.
The health system has about 3,500 nurses, a majority of which are in hospital environments. Smithgall says she's noticed the pandemic taking an emotional toll on them, some even experiencing PTSS.
The nurses have dealt with a higher level of patients succumbing to disease than they're in the previous year.
Smithgall says the health system is continuing its efforts to help minimize the psychological impact on nurses.
We adjusted some salaries, we provided incentives, we provided incentive for COVID care. We increased our employee assistance program. We increased the hours per day that we have that service available.
A study that was published in January through the National Center for Biotechnology Information states that there was a relationship between the lack of medical training in schools or how to approach a pandemic.
It not only was something that created very, very ill people, but also put a risk to self. That's going to really cause a catalyst for education to say, this is what it means when you care for people, so that we can prepare people so that they have resilience and skill sets that they can deal with that.
In Johnson City, Febin Casahoon, News Channel 11.